Hi, I'm Jim Rohde. I'm the founder and CEO of Guardian Birth Care. We're here today to talk about our new birthing device called a BirthBuddy. With us today is Dr. Izumi Cabrera. Dr. Cabrera is a board-certified OBGYN. Welcome, Dr. Cabrera.
Yes, thank you for having me.
I understand that you have used our birthing device. It's a brand new product, of course. Could you tell us a little bit about that, please?
Yeah, I would love to. I found that I have gotten an opportunity to use this device in a few deliveries, and it has been an amazing tool that I am very excited to talk about. One of the more recent deliveries I feel was extremely valuable and informative for me because both of the participants, the husband and the wife, are both physical therapists. And so I was very interested to find out their feedback with how this tool helped with their birthing experience. And in fact, it was a very, very valuable tool. They felt that they had a lot of control with regards to positions, that they could engage the muscles correctly, better than traditional methods such as sheets or towels or just pulling the legs back. They felt that this was a tool that really was the only thing that really helped with their birthing experience in a way that kept it very positive for them.
So, and the father got involved in the birth as well, it sounds like.
Yes, very much. And the entire staff in the room also gave very positive feedback. They were all very excited by using this and felt that the father got involved, the doula, the midwife, and the labor and delivery nurse. They just felt after, pushing 1, 2, 3 hours, it's wonderful to have a tool that provides alternative positions, alternative interventions and interactions with the people in the room.
And if there's not someone there to pull on it from the other side, like a father or a nurse, then we've designed it so that it can be used very effectively with the birthing bar.
Yes, in fact, it does work beautifully with the birthing bar, and it is very intuitive. So the birthing bar slips on very nicely and can be used, again, like I previously mentioned. Previously, they used sheets, towels, other types of mechanisms that are very hard on the hands and can be very tiring and not ergonomic. This is, however, a tool that is ergonomic. It provides both parties to use this, and with the birthing bar as well, in such a way that doesn't fatigue them and can allow them to push longer and feel more empowered by that.
And speaking of pushing longer, many mothers, 80% in fact, of mothers who go in for natural births in the United States are given an epidural at some point along the line. And of course, that reduces their urge to push and their feelings to push.
And so that's often a concern that we address. And ideally, mothers like to try to approach a birthing experience with minimal intervention. But in fact, as you mentioned, 80% do end up with an epidural for pain relief. And the biggest concern people have is that they won't be able to feel. They won't be able to know which muscles to engage. And with this device, the very opposite can happen in that they have the opportunity to really engage the correct muscles. And more importantly, they're actually able to use it before the birthing day and practice with each other in such a way that they can feel the muscles before they are in the situation of being numb or not being able to focus on exactly what's happening. Using the birthing buddy before the delivery day as an exercise is extremely valuable for both parties, where they can practice in terms of knowing exactly the positions and the muscles engaged at that time.
And so this is a new concept that replaces the old ways of pulling on ropes or sheets or something like that in order for the mother to be more effective.
Exactly. So this is just an amazing tool that allows an alternative for the birthing experience. Birthing itself has not changed. It will never change. Babies come out the same way. But the birth experience can be very different and can be empowering to all the parties involved, and in such a way that really everyone can get involved, everyone can use it. If they aren't familiar with it, they can go on the website, they can see the videos, they can educate themselves ahead of time, and it's an altogether just an excellent tool. It's very accessible to look at the website, to see the videos that are on there. All the hospitals these days are all wired and can access them even at the time when they walk into the labor and delivery room. So to provide that information is very readily available even at the time of delivery, even at the time of walking in to be admitted.
Okay, and so we have developed what we call our healthcare advocate program, where birth educators, midwives, RNs, physicians can actually benefit their patients by advising them to look at this ahead of time.
Yes, and I think that's a wonderful, wonderful program because we want to work together as a team. And the goal is to have a healthy birth, healthy baby, healthy mom. And to work together and having that advocacy program allows us to participate in getting this product available so they can ideally have that wonderful outcome.
Thank you, Doctor. I know that you're extremely busy, and we really appreciate you being here today. Thank you again.
My pleasure. Thank you.